Chirlane McCray's appointment did not go unnoticed and certainly not without criticism, especially given the controversial role she's played with Thrive NYC, the mayor's mental health initiative. Nonetheless, community advocates we spoke to say they are curious to see what recommendations the task force comes up with.
My first thought was like, great, we do need a task force. And I thank the mayor for finally stepping up to do that. It's well overdue.
Community leaders in Queens say they are mostly pleased to hear about the mayor's creation of the Racial Inclusion and Equity Task Force, but they do have a lot of questions.
Right now, we can start to address these disparities. We're doing it in many ways. On the healthcare front, with the plans that we have announced, the community-based testing and the outreach programs, the community-based health clinics, many other things working on right now.
The mayor made the announcement Sunday and put his wife and the city's first lady, Chirlane McCray, and Deputy Mayor Phil Thompson in charge. Critics immediately spoke up. Queens Council member Eric Ulrich tweeting and poking fun at McCray's handling of Thrive NYC, a mental health initiative she leads at the mayor's directive. Numerous reports, including our own at Pix 11, showing a significant mishandling of funding at Thrive. The mayor, however, saying he has complete confidence and will include more leaders from communities of color on this new task force. Its goal is to bridge the gap between community groups and the city and immediately address places of inequality. Establish how to work with community-based clinics and health providers, work with minority-owned businesses, and also provide support to essential workers in affected communities. The most recent numbers provided by the city shows disparities are alarming and dangerously clear. COVID-19 claiming far more lives in communities of color than anywhere else. The Hispanic and Latino community making up more than 20% of the deaths. African Americans and blacks nearly 20% with 19.8. Some community leaders like Prathana Gurung, who represents the Nepali community through an organization known as Adhikar in Queens, says the mayor's initiative is a good step forward, but it's also important to remember these racial divides in healthcare are not new and certainly not created by this pandemic.
We're not sure exactly what it's going to be able to fulfill, given that our community has been going through this already for the past month to 6 weeks.
June 1st is the date the mayor has set for the task force to provide their recommendations. He says those guidelines will help get the city eventually back on its feet. From Midtown, Narmeen Chaudhry, Pix 11 News.